Clobetasol is a topical steroid. It is available as a salt, clobetasol propionate. For convenience, it is available in different dosage forms. You can get this medication as a cream, foam, gel, and spray. It is also available as lotion and shampoo. Clobetasol can be used to control the skin inflammation that is often associated with redness and itching. It can reduce skin rashes and blisters on the skin, formed due to inflammation. Another use of clobetasol is in the treatment of plaque psoriasis. It is one of the common types of psoriasis that is associated with red or purple-colored patches and covered with silvery white scales. It may be observed on the elbows, knees, scalp, and on your back. It is a chronic inflammatory skin disorder that forms plaques covered with dead skin cells. These plaques are itchy in nature, and they are painful. They can be easily cracked, leading to bleeding in that particular area. It may also be observed in the fingernails and toenails. For treating plaque psoriasis, clobetasol can be given in the form of foam, cream, or spray. It can also be used to control the scalp psoriasis. For this purpose, it can be used in the form of shampoo or foam. How to use this medication? Clobetasol cream is available at a strength of 0.025%. Apply a thin layer to the affected area twice daily. You have to use this medication continuously for up to 2 weeks to see beneficial effects. You can also use the spray for treating the plaque psoriasis affecting up to 20% of your body's surface area. When you're using foam, apply it to the affected area twice daily for up to 2 weeks. Using clobetasol beyond 2 consecutive weeks is not recommended. The total dosage should not exceed 50 grams per week. Because this is a potent corticosteroid, they have a high potential for suppressing the hypothalamus, pituitary, and adrenal axis. So never use clobetasol for prolonged periods at higher doses. Limit the amount of cream you are applying. Use only the amount sufficient to cover the affected area. Never use this cream more than 2 times a day. You can take cream of length equal to the distance from the tip to the first crease of your finger. When you're using the lotion, you should not use it on the face, groin area, and axillae, as it may produce skin atrophy at the applied area. You should not use the clobetasol in the presence of viral or fungal lesions. Clobetasol propionate cream is not intended for ophthalmic use. Interestingly, clobetasol is also available as a different formulation for ophthalmic purposes, which is used to treat the inflammation after eye surgery. However, this clobetasol propionate cream or foam should not be used for ophthalmic purposes. They should not be in contact with the eye. Clobetasol is intended for topical purposes, and it is not suitable for oral or intravaginal use. You have to apply the cream on the affected skin area as a thin film. If you observe significant skin atrophy at the treatment site, discontinue use of this medication. Do not cover the area with bandages or wrapping unless it is directed by your doctor. Covering the area after the application of this medication may increase the entry of this medication into your epidermal layers. This may increase the risk of systemic exposure. With increased entry into your body, you may have systemic side effects leading to suppression of the HPA axis. It may be more pronounced in the children. Since this medication has strong activity, even a small amount reaching into your body can produce significant adverse effects. Avoid use of this cream on the face, scalp, axillae, and even groin area. Wash your hands after each application. How does it work? Clobetasol is a potent corticosteroid. It decreases inflammation in your body. When it is applied topically, it acts on the skin cells to reduce the inflammatory response. It stabilizes leukocytes. Leukocytes play an important role in the development of dermatitis. They can produce mediators like cytokines that induce the inflammation on the skin. Leukocytes can bind to capillaries and increase the capillary wall permeability. This increases swelling and inflammation. Clobetasol can reduce the attachment of leukocytes to this capillary endothelium. This can reduce the swelling and edema, thereby controlling the inflammation. It can also prevent the release of inflammatory mediators. Clobetasol can inhibit the release of acid hydrolases from leukocytes. Macrophages may be accumulated at the inflamed area, which further increases the inflammatory response. Clobetasol prevents macrophage accumulation. This medication can also block the activities of histamine. Therefore, it can reduce the allergic response. It also inhibits the release of kinin and other inflammatory mediators. Precautions. In the children, clobetasol should be used at low potency. It may be absorbed from the skin upon application. This may produce systemic effects, particularly in the children. Therefore, in the children with an age less than 12 years, the use of clobetasol is not recommended. Clobetasol is a potent corticosteroid, so it should be carefully used in the children. Prolonged use of this medication may affect the growth rate. Therefore, on repeated usage, you may observe a decreased growth of height compared with normal children. Clobetasol is available as a lotion, spray, and shampoo. However, these medications and formulations are not recommended in children with less than 17 years due to more risk of absorption into your body. Sometimes when you're using this clobetasol topically, it may produce a condition called allergic contact dermatitis. It's one of the skin reactions that can be triggered by an allergic response. It may not be observed in all the people. Normally, when a substance comes into contact with hypersensitive skin, it produces a few skin rashes and the formation of blisters on the skin. Such a type of allergic reaction can also be observed with the use of clobetasol in a few people. With that, you can observe the decrease in the healing rates. At the same time, it may further exacerbate the conditions of dermatitis. In such conditions, you should discontinue this medication. You should not apply the cream near the eye. Avoid direct contact with the eye. It may produce eye irritation and redness. Even contact with the eye can produce increased entry of this medication into your body. This may increase the risk of glaucoma and the development of cataracts, which is commonly observed with the use of corticosteroids. Therefore, if you observe any disturbance in your vision or blurring of vision, immediately report it to your doctor. When you are using clobetasol as a foam, use it carefully. The foam is highly flammable, and avoid using this foam near the fire or flame. You should avoid smoking during or after the application of this foam. Clobetasol can produce a few of the local effects on your skin. It can produce a condition called skin atrophy. This is the thinning of the skin, and it may involve the epidermis or dermis. This results in a thin and wrinkled appearance of the skin. With thinning of the skin, the blood vessels in that area can easily appear. Even the skin may lose elastic properties, which may increase the risk of easy bruising and fragility. Clobetasol can also produce hypopigmentation. This may result in the development of white patches at the applied area. You can observe patches of the skin that are lighter than the surrounding skin area. This may be due to the decreased production of melanin due to the action of clobetasol. Clobetasol can also produce a few of the local reactions, like skin eruptions at the applied area. However, these local reactions are reversible in nature, and they can be restored after stopping this medication. Clobetasol can act as an immunosuppressant. Therefore, it may increase the risk of skin infections. They may even develop during the therapy. You should use antimicrobial agents to treat these infections. Clobetasol is not an antimicrobial agent. It is not reducing the infection that exists on the skin. It only acts as an anti-inflammatory agent. Therefore, it reduces the inflammation that may be associated with either allergic response or immune response. Therefore, in the presence of active infection, the use of clobetasol alone is not effective. You have to use a suitable antimicrobial agent to reduce the infection. In addition, clobetasol can reduce the immunity. It can increase the risk of the development of other infections. Therefore, while using this medication, the risk of infection may be increased, which can be treated by using a suitable antimicrobial agent. Chronic use of clobetasol may suppress the HPA axis, hypothalamic pituitary adrenal axis. This may be observed in the younger children or even the adults who are receiving higher doses for prolonged periods. In the children, it may suppress the growth. In the adults, it may develop anxiety, fatigue, and adrenal crisis. What are the side effects of this medication? Clobetasol is a potent corticosteroid, so in order to minimize its side effects, it should be used at the lowest dose possible. The extent of side effects depends on how you are using this medication. As you're using clobetasol topically, it produces the local reactions. You may observe drying of your skin and discomfort after application. It can also produce the thinning of your skin. You may have a feeling of burning and stinging. Few people may observe redness and irritation. It can also produce numbness of the skin, leading to loss of sensation. At the applied area, you may observe light patches, and the skin may be easily cracked or broken. However, these side effects are restored after stopping this medication. On prolonged use at higher doses, it can produce adrenal suppression and the development of Cushing's syndrome. It can also increase your blood glucose levels at higher doses. That's all, guys. This is all about the important information you should know about this medication, Clobetasol propionate. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.